7 o'clock on the dot, Mkaya. We're starting with Home with Mapaseka Mokwele, and we are talking a very interesting one. It's a Thursday evening, yes. We get nice and naughty. We have fun. We enjoy ourselves. Dr. T is with me. Let me start there so you know she's going to be naughty. She's the naughty one as always. Hello, Dr. T.
Hello, my babe. How are you?
How are ya?
I'm good.
I am lovely, thank you. And then we've got Gauteng Health MEC, Qedani Mahlangu. Thank you very much, ma, for joining us.
Thank you. It's a pleasure for being here, Mapaseka.
Thank you very much for your time. We've also got Thami in the studio. Thami, can I go visit Thami, ma? Give us lots of good visit Thami, the sexer.
I'll take Thami Dish.
Just Thami Dish.
Yeah.
Okay.
Dish.
That's enough.
No. Okay.
I dish it out though.
I know you do. And we know more than you think we know. We're just putting it out there. We're just putting it out there. We're just putting it out there. Thank you very much to all of you. Thank you so much for coming through to the studio. Now, you know, Mkaya, on a Thursday evening, we talk sex, yes, but more than anything, we also get naughty, but we get educational. Very important for you to realize that what we want to talk about is, as much as we want to talk about sex, and yes, the humping and the fun and this, that goes with it, we need to understand where it takes us. We need to understand the repercussions of it. We also need to understand what we can do to help it, to make things better for ourselves, okay? So, and this is where we're talking. Hashtag sex in the city. That's what we're talking about today. Dr. T, when we say, no, we're not talking about the TV series. Come on now.
My favorite.
Can you come back? Can you? I just saw your face.
Yeah.
Going to that one. No, we're not doing that one. Okay. Along with sexual activity comes huge responsibility. Mm-hmm. And it is this responsibility that we need to put a lot of focus on. Okay. And for the first at least 20 minutes of the show, I want us to focus on this responsibility. It is important that you realize if you're having sex, or if you're about to have sex, or if you're going to have sex, if you're thinking about having sex, it is important to know that this is a huge step that you're taking. You need to protect yourself. You need to protect your partner. You need to stay safe. You need to stay healthy. There's so much that you need to do. And it doesn't, let's not put it, we're not trying to take the fun out of sex. Hell, you know, Dr. T and I would never take the fun out of sex. But that said, we still need to make it very, very important for you, Mkaya, to understand that we need to talk about this, regardless of whether you're casually dating or involved in a serious relationship. If you're being intimate, it is imperative that you are safe. Okay, now let's take it back to safety. MEC, when we talk safety, we are thinking condom usage, we are thinking one partner, you know, all of those things. This is now the ideal situation, yes? Ideally, don't nod, Dr. T, because remember, we can't see your nod. We want to hear your agreement with us.
The ideal situation, and life doesn't happen in ideal conditions.
Sadly.
And I think that's where people then struggle with the whole sex and safety around sex. Because sometimes we focus too much on being too idealistic and too perfect, you know? Meanwhile, sex happens in not so perfect situations with not so perfect people. And that's why it's important to...
So we need to... When we're talking the message, and of course we're talking about this because we want to tell you, Mkaya, with the upcoming AIDS conference, HIV conference that's happening in Durban on Thursday, the 21st of July, we need to talk about this and just bring it forward to say, you know, it's not only a daily thing. It doesn't happen on that day, that is. That's what I mean. It doesn't happen on that day that we talk about HIV and prevention and everything else. But every other day, we need to be talking about the importance of taking care of oneself, the importance of being safe, and understanding all of that. Where do we start, MEC? Message number one, what do we say? You know, when we start by saying, okay, we are not talking to people who are thinking of having sex or people who are having sex. Educate. Where do we start?
I think the most important thing for us is to always encourage people to be safe. And I think you've already spoken to those issues relating to safety when someone is about to have sex, because if you're not taking precautions yourself, you are putting the next person in danger, but also you do not know where that person was, and the person does not know where you were before you came to them. So and I think the issue of safety, more than anything else, is important, whether you use condom or you are simply taking other precautions. And of importance, we know that South Africa, in the past few months, we've already introduce what you call a pre-exposure prophylaxis, which is a tablet or what do you call it's medication or tablet you take before you have sex, particularly amongst the risky groups, which we know that, and it's well documented that the levels of sexual exposure are very higher than other community members. So that is important. Again, this is part and parcel of ensuring that people understand what they are doing, that you are conscious about it. They are more likely to get involved with someone that don't know where they've been. But I think the other important thing for us is to make sure that you take, when you get involved in the sexual act, indeed it is a serious act, but others, they see it as fun. I've come to understand that is being it fun. Don't be reckless and put other people in danger, because
let me
it may be
take
two
you back.
people, but they end up affecting whole strings of people involved.
Let me take you back a bit there, MEC. You mentioned that people are, at least there's a prophylaxis out in case you're going to.
Yes.
How do you know if you're going to be in danger? What circumstances are we talking about? Are you talking about if you're going to a place and you suspect you might be raped, you take it? Is that the case? Or you know that
currently because the tablets are very expensive, we are supporting the risky communities, which we simply is sex workers, in the LGBTI communities, the drug injection users, those people. So currently we're confining it to those, as to, of course, how do you know you're going to do something? And we all know where there's a involvement of human beings and partying and alcohol, it is highly probable that at the end of the day there'll be sexual activities that are going to happen. So, and I think it's important to, even if you don't know whether you're going to have sex or not, it's better to be safe and take precautions than to be sorry later when something has happened and you end up having contracted HIV, which you could have prevented.
Very important. You wanted to add?
Yeah, I just wanted to add on the pre-exposure prophylaxis, which is what the MEC is speaking about. It speaks to the whole notion that people need to understand their individual risk when it comes to the type of sex that they are having. So if you're a commercial sex worker, if you're a man sleeping with other men, if you are someone who's injecting drugs, you are at risk of HIV, because we know that the needles get reused by other people. When you are high on drugs, your level of judgment is not the same.
You're not even watching.
Exactly. So there are certain groups that are targeted, as a rollout by the government to say, we know that you are at a higher rate or at a higher risk of getting HIV. Therefore, you will take the treatment as a pre-exposure before you get the HIV to try and lessen that risk of you getting HIV. And, those groups are they've been identified. We know the stats about it, and which is why evidence-based medicine is so good. Because if we can see that, we were thinking in one direction, but the stats are showing us something else, we need to be active. And hence the pre-exposure prophylaxis has become a thing. But we need to take it that within the context of people need to understand their risks. So, let's not get so hung up on the labeling of, I'm gay or I'm lesbian or whatever. But let's get into the crux of the matter is, what type of sex are we having?
But do people
and how
understand,
do we make it safe?
Do people understand their risk?
They don't.
I think that's point number one.
Yeah.
Do they understand? Do we understand the type of risk that we put ourselves in?
I'll tell you why. But it's quite difficult to quantify a person's risk of getting HIV. For example, a vagina being penetrated by a penis without a condom. It's very hard to quantify that for somebody.
I get you.
Therefore, unless patients feel comfortable talking to their doctors or their nurses to break all of those things down, because if I assume that Basi is married to a man, if they come to the consultation room, I'll only give you advice based on people who are having a vagina and a penis and sex together. What if your husband is enjoying sleeping with other men? He's not necessarily identifying as gay.
As a woman, I sleep with other men.
With other men or other women.
Or other women, for that matter.
Or you are still that heterosexual couple which is married, but you still engage in anal sex. Now that still puts you at a different risk altogether than people who are only having vagina and being penetrated by a penis. So the health advice and the risk assessment has to be on that individual level.
Let's agree, Hore. We've seen the tactics that have been used in terms of making people aware have somehow scared a lot of people, but not necessarily helped deter people from having sex. Sadly, we still see a lot of people still comfortable with, as you were saying, MEC, the comfortable thing, I'm going to a party and I might just, maybe I'll get some. And the next morning it becomes, it's fun. Yo, what did you do last night? Oh, no, I got some. Wait, I don't even know his name. You know what I mean? And you find a group of people. I was in the bathroom.
Don't remember.
And people walk out and they come in and they think it's funny, you know, and they walk out and they think, you know what I've just done. With who? I don't know.
The young ones today, these young ones today, but I also, I mean, I'm not that old.
No, we're not that old.
It's okay, guys, convince
Okay,
yourselves.
no.
It's all right.
I'm young.
But I mean,
Do you know when those young ones look at you, they're talking old?
I
Okay.
know, right? They're
They're
calling us
rolling their
12
eyes. They're rolling out their eyes, yeah. But I mean, I used to be young and I'd carry condoms everywhere I went. But it wasn't because, I mean, I come from a different background. I've never had to hide my sexuality anywhere. But I knew that I wasn't particularly dating anyone. And I was young, and we have sex when we're young. And we have different kinds of sex with different kinds of people. And it wasn't something I didn't want to avoid it. It's something I wanted to do. I wanted to, you know, go out and have that kind of story and a very fun and enjoyable story. But I carried condoms because I was like, yo, ndi hot.
And therefore,
Zawushelwa
and
whatnot.
Zabana Bahot.
But you see, for me, it's one of those things that the conversations we have with the department that, you know, you can't avoid those things. We've got to start communicating the truth to a lot of young people. And I'm glad that the MEC is sitting here today because she's been championing those kind of discussions and the programs that we put behind ensuring that people have safe sex. But yeah, we are sleeping with each other, you know,
more than we'd like to agree to.
And you were talking now about the heterosexual thing and anal sex. There's so many other heterosexual couples that are practicing anal sex.
I mean,
It's a bigger number than you actually.
We get calls all the
asking, how
time
do
on
we
the
do
show.
it? Yeah.
Now, here's the thing. You know, I mean, when Dr. T and I do the show, we talk about sex openly. But the flack that we get, more than anything, tells me that somehow as a society we are still not comfortable to talk. Which also tells me that we still think it's okay to hide behind they don't see me, therefore they don't know. But you see, the danger is not in you being seen. The danger is this that you will get once you engage without protecting yourself.
Hence the stigma for HIV. Because now you're wearing, people think they can see that you are sick, right? You lose weight and all of these things that we always speak about, that just because people are losing weight or they look a certain way, it doesn't mean they have HIV. But then the stigma comes where people feel that, okay, now people can see that I've been sleeping around.
And this is
And
why
then
cancer and
people feel
HIV, and
judged.
in fact, let's talk about everything else that looks like HIV anyway. When you're sick.
Diabetics, if they are untreated and
Do you see?
undiagnosed, if you have TB, you may look wasted and quite ill. Some of the cancers can do that. Maybe the cancer, not the cancer itself, but the chemotherapy for the cancer can make you look quite ill. If you have some of the thyroid diseases, you can look quite ill. And some of the hormonal, you know, imbalances can make people look quite ill. Hence, we always say, don't just stigmatize people because of how they look, you know. And I suppose that's why there's a lot of judgment around HIV, because of how it's transmitted. If it was transmitted in any other way and not sexually, I think even the way that we approach the subject would have been different.
I find it difficult as to why we would then stigmatize it because of that. I mean, for goodness sake, we have babies because of sex. Do you understand?
Yeah,
So we should
but
be saying...
socialized in a way that says, you know, sex is not for enjoyment. So, you know, once you tell the story of the fact that you were a sex worker,
It's a
that you get
different case
stigmatized
altogether.
because it's
I must-
almost like, oh, okay.
I must tell you that
The MEC always gets shocked at those stories.
I must tell you that when I was pregnant, you know, I remember walking into a...
Tammy
Tammy does this to you all the
No,
time.
I mean, it's a fact. I know it's a fact. Like all these things
Are shocking.
But you know
let
what?
me
She's
tell you,
not
I remember
allergic
walking.
to it.
I remember walking into a room full of people. It was family, and I was pregnant. And you know those, you're not really my uncle, but you're here, so we'll call you uncle. You know that guy in the family. Stands up and says, "Yeah, I know we know what you've been doing. This is what you talk about on the radio. Look at you now, you're pregnant." And I thought to myself, I'm a married woman, and even if I was not, why is it your business that I am pregnant at my age? So, of course, me being me, you know, I didn't keep quiet. I responded, and he was hell of a shocked. He almost fell over. But I thought about it later on, and I thought to myself, this is exactly why people will not talk about sex.
But I think there's stereotypes in society. If you raise children, I've got teenagers. My son is 22, and probably most of the young people that I associate with in the family are more or less in the same age, probably slightly in their teens. when you broach the subject about sex, sometimes they are uncomfortable about it because and I remember when I was growing up, the subject of talking about sex with my mother was just never possible. So because of how we grew up and how we've been socialized as society, talking about sex is so taboo, such that when you even watch television, there's a sex episode, it becomes an issue. I remember many years ago when I was in Parliament, the Yizo episode happened, and I think Peter Matlare at the time was the CEO of SAPC, and I was probably one of the few youngest MPs in Parliament then. And SAPC came before the Portfolio Committee, and MPs were like so horrified with the whole incident. And I remember saying to the committee that in my constituency at the time, which was Duduza, I said to them, I see these things when I do constituency work. When you walk around in schools, visiting schools, you don't find kids in the classroom. You find them close to the shippings and nearby. You find them walking with a guy into their home, yet carrying school books. They are drunk and all of that. So we can say the episode should not have been aired, but the bottom line is those things are happening behind our back or under our nose, and we assume that my child has gone to school, yet they've gone to other places, or has gone to a shopping mall because I did not go with her into the shop. I mean, I know there's a lady who used to drop her daughter every day, every Saturday in Brooklyn, and a few months later, the girl contracted HIV simply because she'll drop her at the gate and then leave every Saturday, and yet when she goes wherever she was going to, someone will pick her up and they go somewhere. So I think the point is that we, as a parent, and of course interacting with young people and what I've been exposed to, and as a MEC for Health, I think it's important to be frank and honest with one another. And some of the things that we are so stereotyped to assume that my partner would not have a relationship with somebody. I trust him so much that when someone tells me, or when I hear that my partner is sleeping around, it's like, no, ufuna usiqabanisa, ufuna ucitha umuzi wami, or whatever. Yet the person is doing it. Also, when I do things behind my partner's back. So the issue, my point is, we should really try and be honest with one another. People are fooling around, married or unmarried, and therefore we all have to protect ourselves. And the more you use condom, the more we understand who we are sleeping with, the better it's going to help us to take the right precautions. Even if you're married, you are not circumcised as a man, make an effort of going to be circumcised. It limits or minimizes the risk of you contracting HIV and so forth and so forth.
You tell people that you are married, and I understand that you're married, but test for HIV.
Yes.
And they tell you, but what are you saying?
You give married people condoms. They show you the finger. They're like, I'm married, darling.
And that's not a condom. That does not, that ring does not. That ring does not prevent HIV.
You know, I always say to my patients,
that ring is not tied to the penis. That penis is not.
Because we could be in consultation now.
Yes.
And I always say to my patients, but you here with me, but your partner doesn't know that.
What's happening?
What if you were somewhere else and you just said, oh, no, I'm going to consult, or I'm sick,
or
whatever.
Or what if you actually felt, or no, let's do something now? Then what? Do you understand? And I say to people, go and test. Go and test. Know where you stand. Because it's not even about the partner. It's not about catching anybody out. It's about your health. It's about knowing where you stand.
I mean, that's why the 1990, the UN strategy is more important, Mapaseka, because it says, you must know 90% of us must know our status. Those who know their status, and remember, one of the things in the next coming few months is to give anybody who's HIV positive, even irrespective of your CD4 count, to get a treatment. So 90% of those who know their status must be on treatment, and 90% of those who are on treatment must have their viral load suppressed. And remember, having your viral load suppressed doesn't mean that you're no longer HIV positive. And I think many people are confusing that. So I think we really...
Very important.
Yeah, so we really need to find a way of getting South Africans to talk about things that are uncomfortable. We have men's clinic in Gauteng. One of them is in Soweto. One of them is in Amaskral. One of them is in Hatfield. One of them is in Yeovil. Those men's clinics are very popular. they are seeing a lot of men, gays and lesbians, and whoever men who's got issues who want to talk about to other professionals in order to understand them. And I think we must really promote and understand what is happening in our society, including the drug injection users, because those people are out there. And we agreed at the Australian AIDS conference in 2014 that government must make an effort of providing the injections so that you prevent someone reusing the injection and over again. That is very, very important.
Let's take a quick break. When we come back, we've done, and I'm happy we're talking the education part of it as well. But I also want us, when we come back, to talk about how people are having sex, the type of sex that we are seeing happen, and where we are seeing it happen. Yes,
Look at
I see the looks and everything else.
She's like,
Let's take a break. Let's take a break.
Jesus.
We're back on Kaya FM 95.9. I'm Kaya. Thank you so much for staying with us. It's a Thursday evening and we're talking sex, and more sex. Please make sure you keep... In fact, I'd like to say, the first part of the show, you shouldn't have kept your little ones out of earshot. Maybe you have them listen so that they understand and get the information whilst they are young. And they don't wait until they're 25 to then find out actually what's happening. But for now, I want us to talk about, and this might be a little bit uncomfortable for your little ones, so you can keep them out of earshot for this one. But I want us to talk about how people are having sex. We make the mistake of thinking that girl meets boy, girl likes boy, and then go out, date 1, 2, get married, and then after they've gotten married, they go home and under the blankets, after they have closed all the doors to their house, the dining room door, the done room door, and they've closed everything and they're in their bedroom, then they get into the blankets, and oh my gosh, it's just missionary, and that's all there is to it. That's not how people are having sex. And I think we have seen, we know, that's not how people are having sex.
Listen, sex in the city of Gauteng, Johannesburg,
is
far
happening.
from that.
Yeah.
We could write, dissertations on the
Upon
sex
dissertations.
that's happening in Gauteng, in the city of gold. And I think we need to realize that Joburg holds such hope and dreams for so many people that come here, whether they're looking for job opportunities or for education or for fun. I know people that still travel from Polokwane, they come from Durban,
Yes.
and they come to Joburg 2
For
or 3
fun.
times a
Yeah.
weekend for fun. And we need to understand that part of that fun
Is
is
sex.
sex. Johannesburg,
Most of that fun is sex.
And people in Joburg
Everything
have money to
else
spend.
happens to be in between.
Yeah, we've got spending power in Johannesburg. So the rock and roll that we speak of, yeah, of course we do. The rock and roll that we speak of, we've got drinks,
Sex, money, and alcohol.
drugs, alcohol,
yeah.
it mix. Strip joints. How many strip joints are in Johannesburg?
I've
Tammy,
been to so
I want
many.
you to share that part, because you and
Wow.
I were chatting earlier,
Yeah.
and you were telling me that you have, about where you've been, that those joints that you've seen things happen.
Tell us,
at.
Tammy, tell us.
Tell us all about it,
No, apart
and
from-
don't sugarcoat it, please.
No, apart from me being curious and inquisitive, it doesn't help that I had a lady the MEC who said, I think we need to come up with a campaign for HIV. I had a beautiful excuse for me being able to go through everything else that I've ever wondered.
It's for research,
Oh,
babe.
it was
It's
research.
always
It
for
was all
research.
So I've been
Research. Okay. Anyway, it's fine.
No.
It's fine. I'll
No,
buy
no.
it. I'll buy your story. Go for it. Go on.
No, it was fun research.
Yeah,
Let
that's
me
it.
tell you
That's
that for free.
exactly it.
I've walked into a nude bar, a gay nude bar, and I had to strip completely naked, and I could hear people say, Thami Dish. I said, yeah, darlings, I'm here and I'm naked, and get over it. Let's have a drink.
Tamiwe, Talos,
Hey,
explain. You walk into this bar.
you take off your clothes.
That's one of
Everybody,
the
every
prerequisites.
Single body.
every single party on you.
Every single body you take off, you leave in hanger, you get a number
Yes.
to purchase the drinks, prepaid.
Okay.
You put there, they load the tab. You go in, and there are all kinds of things there. It's a gay nude bar, all male.
Let's talk about this. Once you walk into a nude bar,
Oh.
okay, we already know that you're not going in there to pray.
Yeah.
It's not church. It's pretty obvious that this is not church.
Or it's church of a different kind.
Well, yeah. But what I'm getting at is, when somebody walks in like that, we know that obviously they're thinking, I'm going to get some.
Are
Yeah,
you?
But you see, many people go there for various reasons.
Like
I've
research.
No, I don't mind perving. I could sit at the bar and have a drink and perv over the most gorgeous bodies alive, and but that what I found in the past is that there's so many of I say this now, like friends, fathers, colleagues, bosses, executives, etc., who I've bumped into in those spaces who I know are married,
Sure.
or I was
And supposed to be single.
and supposed no, not single, married. They're
Well, I
supposed
mean
to be
straight as well.
straight.
Yeah.
yeah,
Whatever straight is.
yeah.
Yeah.
I mean,
Mm.
that's
That's a topic for another day. Yeah.
and they there to get whatever it is that they want to get out of it. So everybody goes there. It's the thing about sex, like, you know, it's so fluid. It's also it's in that moment. People be as and when it feels right to them. So if a person
Hold on. When you say people walk in, what happens? Do you walk in and actually literally see people bonking everywhere?
there are areas in which you can go to bonk. And then, I mean, it's a similar thing with heterosexuals. You go to a strip joint, you go to Summit, wherever, Royale, wherever we've gone to, and people are, you know, you're allowed to take a girl to the room and have sex with. It's the same thing, except in our environment, you'll find that, you know, there's a little dark corner there where nobody sees you and they're having sex. And the most important thing for me was that, okay, how are these people having sex? Are they being protected? And, you know, I mean, it's not, you don't just contract HIV through like, you know, penetration. There's so many people who've got like herpes, you know, who have got any other like other illnesses. I mean, these
Other
ones, they were
STIs, gonorrheas.
and you check these ones that are going for the blowjob. They're going for it.
And they're going.
They're going.
I was about to say head first, but yeah.
Well,
She look at how shocked she is.
Oh, man.
oh,
And you
but
see, at this point, we would like to say, Zoqinani. Strength to you.
Solid.
and you know why I love
solid.
that she's here.
Yeah.
Qedani. It's because she's responsible for signing off some of these policies, some of these campaigns, some of this programming that is supposed to be for young people. And we are just young people who, yes, we work in the field, but we see other young people and we speak to other young people. And they're asking for things like, you know, the billboards have to be language
Straight to the
sensitive.
point, yeah.
So also stop using he and she only as if those are the only types of relationships. There's you know, men having sex with men. How are the billboards speaking to them? There's women having sex with women. There's, you know, transgender individuals. There's bisexual individuals. And how is the language and the pamphlets that we're giving, how are those speaking to them?
And then there's our little kids who are actually having sex in schools. As much as we want to...
Little 10-year-olds,
Yeah.
12-year-olds, and
As much as we want to turn our eyes or at least our minds away from that and say little kids are not doing this, but we are seeing it. Besides the fact that we'll see it recorded and it will go viral once every 3-4 months. But for that one that is recorded, there's a whole lot of others
That you never see.
that you actually never get to see. But you see it, little kids are having... I mean, when you look at the stats and you look at HIV prevalence, you can't tell me. I mean, in your 15-year-olds, it's quite high.
I think part of the problem is that there was a research done, it's called HEATS, so higher education institutions in South Africa, all of them. And one of the shocking statistics it reveals that girls were more scared to fall pregnant than to contract HIV. And some girls, some of them were on Sowetan, they were saying they grew up in very straight and formal and serious families with values and whatever. The minute they got to varsity, they wanted to explore and try things. And I think what the message for me out of all of this work that we are doing in the department as government with all our stakeholders is really that parents must be encouraged to have a conversation with their children as open as possible. Because when you do not have a conversation with your kids, is as uncomfortable as it is to talk about sex and everything associated with it, they will go out and explore and get things in the streets, and that is the most dangerous thing. One of the things I heard from one of the guys called Brian, he was saying like sex is not about... it's not like a formal thing like we know it, this thing you're describing in the beginning. Sex for him is not a commitment thing. I can have sex in more than 5 people, and for me there's nothing wrong with it.
That's scary.
Exactly. So that's again, all of those things are revealed when you read that a report. So that has been produced looking at working with young people in universities. So we've got to have our ear on the ground. We've got to understand what are the things that are are being said or are uncomfortable, but be able to be bold enough to talk about those messages in public and run public education by those who are active in the sectors. And I think that's what we're trying to do and trying to respond to.
What do we do, though? I mean, in terms of, there's campaigns that MEC, your department has come up with, and that have been working very well. But we see that people still, for some reason, tend to see it, get shocked, get scared for all of 5 minutes, and then walk away thinking, no, it's not about me. I won't get HIV. I can have sex. It's about the next one. It's about it's almost to say there's somebody that fits, or there's a little box where you can put these people in and say, these are the people who can get HIV.
But I think that is so wrong, because I think we need to get a change in mental society. As you go to the AIDS conference next week, and when it starts, one of the shocking things I learned when I went to Australia, I was shocked, and I'm still shocked today, that South Africa is the biggest contributor of the number of people who are HIV positive in the world. We're contributing 17% of the HIV positive people in the world. One country.
That's huge.
One country. What does it mean? It means many, many things. We can translate it into so many things. But as South Africans, if we do not look at ourselves in the mirror and say this statistics is not good for us as a nation, then we'll continue to have the kind of problems we're having. But we all have to look in the mirror and say this has got to stop. And there are certain things that are in our control as individuals. Becoming HIV positive, if you are not raped, or if you are, and many other things, probably how you can get AIDS through injection or someone else by accident, you can prevent from getting contracting HIV. But I think South Africans, are very casual about that, and I think we've got to have that conversation and deal with it. Yeah.
Let's go back to how people are having sex, the sexual lifestyles, and I'll tell you why I want to take you back there. Are people in Gauteng, your urban areas, are they having sex differently to people in rural areas?
I think the pressures and the reason sometimes why people do certain things may be slightly nuanced and different. But one of the things that especially the men were telling me last week in Gauteng is that they do what they call slaughter and pass.
Sure.
Yeah. I mean, even for me, you know me and new things. Even I was shocked. I was like, what? Slaughter and pass.
Okay.
That's what they call it.
What does slaughter and pass mean?
There's no time to share, right? If I
hit and run.
But also you pass it over. So there's a whole culture. It's not even. You see, when you do hit and run, you can hit and run and you never talk about it. There's a proper network of people who are like, no, I'm done there, Mchana. You want to go?
You can go.
You can go.
Okay. Stoko Cecilio, right? Stoko available. Let's move right along.
Exactly. And they were saying that there's no time to like hushelana formally. That you don't have weeks and weeks and weeks to try and build up this relationship, will then culminate into sex. The sex itself is the target. So when I say hi to you, Thami, in the street, it's not because I'm saying now let's invest in our emotions and none of that. People
Sex
are shelling or being shellared for that.
Sex has changed.
It's on a Mavoso.
I want us to go to the Mavosos because that whole Mavoso thing, we are not understanding thoroughly. And I say we are not understanding thoroughly because we kind of think, oh no, they go out, people go out, they have fun, and then the next morning somebody leaves. You need to understand the sex that happens there, the transactions that happen there, and of course the dangers that lie within that. Because
it's the power dynamics that's the problem. It's like with the whole blessee thing.
Yeah.
We know that but we know that
we're just like we're putting an English term to it.
Intergenerational sex has been happening for years.
The longest time.
I mean, we've had sugar daddies for the longest
or whatever, because it's the current lingo, it's a pop culture. But the act itself of transactional sex or transgenerational sex has been happening as far back as humankind. But the problem is that us as young people in 2016 have the different pressures in terms of health implications. And that's where the difficulty is, because people still want to have sex despite knowing what they know, despite knowing about HIV. We need to understand why do they still then make those choices. And it goes back to the whole power dynamics thing. Socioeconomically, if people have to choose between selling sex or being out of shelter or being out of food, then we find that people will tend to sell sex for things like that. And as a country, we need to decide, is it okay then for women to sell themselves so they can take kids to school, because that's another side of the coin.
But I think so maybe Tom, just a small point. I mean, I would do some work with the students at the universities. One of the saddest things for me, though, is that some girls come to varsity, they'll get a bursary program, whether it's the NSFAS or whatever, but that may not be enough to cover their daily living expenses. And I've had horrible stories of girls who have to sleep with lecturers, and simply because they do not have money, or to sleep with any men that come their way in order to survive. And I think we underestimating this problem of poverty amongst we providing food. Government provides food at the high school, primary school, high school, but the varsity element we haven't looked at it. And I think that's where these girls are more exposed to that. We're providing dignity packs, dignity packs up to high school, late primary school, high school, but we don't provide them there. And I think that's where we need to be looking into the new direction, because those girls are exceptionally vulnerable. And when they get the step there, their future is gone.
What are we doing wrong?
Yeah,
This is a project that she's very passionate about.
Okay.
Young girls. No. I've had this conversation a lot of times.
Yeah.
She's passionate about. But you also find that, and this is the complete opposite. You find that there are people who have all of that, and also all they want is just sex.
Of course, yes.
You know,
And
they
that's okay
engage
too.
in group sex. I remember the MEC once said to me, listen, tell me, there was a report that came out that people in varsity are having this thing called group sex. Well, I don't know what you call it. I said an orgy.
An orgy.
They're having orgies.
And
That's
those are-
nice.
Orgy party.
You would say that's nice.
Themed and everything. And
But they are
here's
themed
why.
and all, yes.
And then here's why then the sex or the sexual health advice comes in. That's relevant for a context. Use the purple condom for Thami, the orange condom for Tlaleng, the yellow condom
thank
for
God for
Pasi,
MECs.
so that we know that the yellow one is Pasi's,
Yes.
right? So that you don't do what you do, cross infections or cross penetration. And even with people having anal sex at home, you need to have the color coding. So the purple condom is only for anal sex, and the orange one is only for vaginal sex, so that also you don't cross transfer germs.
You know,
but that's
and
how
I'm
you do it.
actually
That's how
thinking
you
she's
do
very advanced,
Because
because if you take it back to the household, sadly, you're not going to find mommy and daddy thinking, baby, purple condom, remember, anal sex, and then, no. Sadly, everybody goes from
Exactly, but
waste area
practically,
to entertainment area all at the same time.
That's how you do it practically. And so when we say the campaigns and the health education has to take into the context, we're never going to say to young people, don't have orgies. They won't listen to us, you know.
So-
Even the threat of going to hell in the Bible doesn't scare them.
No.
So
that doesn't
I'm
work.
not going to score them. And the scare tactics hasn't worked from the previous messaging around HIV to now.
Yeah, but I mean,
you know?
what is impressive now is that government is not telling people not to have sex. It's telling them that if you are going to engage in sex, at least be safe.
We
But
can take
I mean,
it
no.
further.
But we've always, government's stance has always been very clear. You condomize if you're going to have sex, you abstain, and then all of that, and to prevent yourself, whatever. So I think the message has always been consistent. The issue here is, I think the behavior of individual is changing, but very slowly. In some age groups, we are regressing. In some age groups, we are getting better. And I think we must just sustain the message of the conversation and the messages right through the program. Because
Which age groups are improving? Who's getting it right?
I think the middle age, my age group, so the middle age people, probably
Oh,
those
you're
are more
slowing
stable.
down a bit.
Yeah.
But I think also people who are 50 and above, there is a trend that indicates that there's new rate of infection, because people are assuming that I'm stable, my partner is not doing anything, and you might find that both partners are hitting other areas. Of course, the younger group continues to be worried, and the age is getting younger and young. And I think Professor Salim probably is going to speak at the AIDS conference. One of the things he shared with us was that these girls who get pregnant is not from their age cohort, is from people who are much older than them. And I think for me, the next conversation we must have, even at the AIDS conference, is how do we get these older men who have money and who wants to make themselves to feel younger, by just messing up the future of these girls, because our intention is not to marry them or to have a stable relationship with them. It's just to have sex and move away. Whether it's the slaughter and pass, I don't know, but it's absolutely incorrect what these old men are doing to these girls.
Let's take another break. Can we do that? Right, let's take a quick break, Mkaya. When we come back, we'll chat more about this and just go again into the AIDS conference itself and what we aim to achieve at the conference, so that we talk more about how we can help, how we can change things, and how we can make South Africa a better South Africa. Let's take a break. Hashtag sex in the city. And we talk about this, Mkaya, because it is real. Sex is happening. So this turning a blind eye, this putting our heads in the sand like ostriches and pretending that it's not happening, it's not going to help us. Little kids are having sex. Adults are having sex. Well, I want to believe 70-year-olds are having sex. Everybody is having sex. Okay? And therefore, let's do something about this. Let's make sure that it's done right. Let's make sure that everybody is healthy. And let's make sure that you're protected. So those are the very important things that we want to talk about. Let's go to... You wanted to talk about bless us just before we go to the AIDS conference?
Yes, I just wanted to take off from what MEC was saying about, the blessers and why young girls find themselves so vulnerable, to these older men who know exactly what they're doing. And I think, our implementation and the policy, even in some of the wording, in our legislation, has to be women-centered. It has to take that approach that says, we need to take care of women, because we know in South Africa, the labor force, it's women. When you go into universities, it's the girls who are the majority. We're making, headways in terms of managerial senior positions, women CEOs. But what are we doing in terms of the experience then of the women in the country? There's still no daycare for women who have to go to work. Women still commute long distances to get to work. We still don't have as much rollout in terms of the female condom as we do compared to the male condom. And yet we know that we are the ones at at risk of getting HIV. And we then have to have the burden to negotiate condom use by a man whom, depending on the power dynamics, may not be as simple, because we need money, so we will do whatever he says he wants to do. So we need to look at little things like that.
But that conversation, Dr. T, where does it take us back to? I mean, do we say then we need to talk to girls at a certain age group, where we sit them down and we say, listen, this is what you could find yourself, open to, or this is what you could be exposed to, and therefore know how to deal with it in that sense. But we also need to be talking to the guys, I think.
Not just girls. Yes.
I think we need to speak to because but also the structural inequalities, and the way it's sort of the solutions are sort of favoring the males. So it's the free male circumcision, the flavored condoms, but we're lagging behind into women targeted solutions when
that's
it comes
a whole
to
societal
HIV,
issue that it takes us back to patriarchal backgrounds of
hence I say when we implement policy, we have to be we have to work even harder to make sure that they are centered around solutions which directly impact on women's, for example, empowerment. But when you say economic empowerment, how, if I fall pregnant, or for example, as a school child, you can't access the clinic because it's closed, and they then stigmatize you because you are in uniform. So by the time you go home and change, it's already 5 o'clock. You can't get the contraceptives you need. And unfortunately, girls and women have to wear their mistakes. You see us pregnant, but you don't see the same for boys.
You don't see the guy who actually
So when these kids fall pregnant, there's still no options for them. If they don't want to carry on with that pregnancy, what do they do? Where do they go? When must they go?
Let me see.
And so it goes over in the chain. So once they have the baby, there's still no child care. The grannies are meant to, they're made now to take over the newborns while the girls try to go back to school. And then when they do try to get a tertiary education, we test them for virginity to say, well, you must be a virgin first to qualify. So it's a whole thing that
stumbling
when
blocks
it comes for women all the time.
Okay.
Just when you get over one thing, there's another hurdle, and it's structural.
MEC, you wanted to respond to that?
But Dr. T, I agree with you that the odds against women are probably worse than men. But on the policies, there are policies and they are protective of women. Hence, I think we see more domestic violence now than ever before because men feel that women have got too much power over them, which absolutely is wrong. But the bottom line, we've got legislation, we've got policies, and some of the policies, I'm afraid, are being abused. I'm probably one of the young women at the time. 1994, we supported the Women's Charter when it was just after 94 to make sure that the termination of pregnancy legislation repealing the Sterilization Act of 1976 was done. So the Termination of Pregnancy Act, as we speak, is being abused. It's used as a contraceptives rather than when a woman is raped, when the child is going to be born deformed, and all of those kind of reasons. So it is abuse, and I'm sure we can give you a lot of cases. So what I think the important thing for me is the case around the female condom and its structure and how women need to negotiate about the use of the female condom. And that's an important conversation because I've looked at that condom and I've always seen demonstrations about it. And I'm not sure how on earth am I going to, and the women I've spoken to, they say it makes a lot of noise. And I don't know to what extent because I've not used a female condom. I'll prefer to use a male condom than to use a female condom. So the first issue I think we must come to the structure and how the female condom itself look. But for me, it is a deterrent just looking at it and how it gets structured. The second issue is we've got to find a way really of empowering girls. We come from the patriarchy is an absolute point that she's raising because when we grew up, I knew that my brothers must grow up because we're given cars and toys and everything else that are macho than you sitting in a house and cleaning and learning to bake and all of those things. And today things are completely different. So, and I have a firm belief that if you teach your boys and your girls at home that a girl is valuable as your sister and the girl who's walking in the street, you would likely to have a young man to grow up to become a responsible man when they go out there. Similarly, when you've got a girl that you're raising at home, you must raise them differently. And I think if we can just families spend time in educating children when both boys and girls and of their responsibility when they get out to society, we're likely to have better outcomes than where things are. The Gauteng government recently has approved a document, which we can send it to you, Dr. T, called the Gauteng Acceleration Social Transformation Strategy. At the center of that document, of the policy, we've said the issues about the family as a key as a nucleus to our society is very important because if you have a functional family, you've got a functional community. Functional community means that you've got all the amenities around and all of those things, because one of the reasons that people use currently of not of falling pregnant prematurely is because they do not have extramural activities and school grounds and sporting facilities in the communities. So this becomes an excuse. But I think with the fact that we're wanting to build integrated communities with all the amenities in a community like it is in the suburbs, you're taking away the barriers that are currently being used. And therefore, and if our families are well functional, you should be able to have kids learning to read more, kids learning to understand that there are a speaking competition and all of that, including wanting to compete all over the world. We've got a lot of young people today than compared to us. They've got a lot of opportunities and a lot of information. And I think we're not seeing the uptake of that to the extent that we should be having. Instead, we're seeing more young people being despondent and not taking initiative. And I think that's what is really killing our society.
All right, Dr. T, you agree with that?
Yeah, no, I think it's great, because we need the, to give girls information so that when they have a situation where they have to make choices, they have to be informed choices.
They know what they're doing.
You must
And
also
that's
give
the
boys.
thing.
Why are you always
But remember, the system is designed to suit boys. We already have how many flavors of condoms for boys?
No. But the point
So
is,
you-
but
so
the point, Dr. T, I think more than anything is to also say to the boys, listen, you need to understand.
Raise them differently.
Respect.
You need to
have
understand
respect.
how to respect her. You
Yeah.
need to
But they
understand
also
that she's
need
a
to see
woman.
it modeled, because who's going to tell them to respect women if their fathers, for example, don't respect their moms? when the
So that
cousins and
modeling
every-
has to come
So the
down.
modeling, it's more than just us saying we must raise kids differently. We must also be different as the adults.
Let's go to
And-
the AIDS conference. What are we hoping to achieve with the AIDS conference, MEC?
Well, this is the conference that happens every 2 years. It was in Melbourne, 2014, and the theme of the Melbourne conference was focusing on the vulnerable groups. Hence, after we came back from Melbourne, was to say what is it that Gauteng and South Africa must do as part of preparing for the conference that's to be held in July, now in Durban. Firstly, I think is to give a report as what is it that we have done as countries, and also to look at what the NGO sector is doing. And remember the communities that we identified: men having sex with men, the LGBTI, the people using in the injections, the sex worker, the commercial sex workers, and all of those groups, so that that's why we've got the clinics, the number of male clinics we have in the province as part of responding to that. But also then have a conversation going forward as to how, and I know there's been a consultation prior the conference of getting young people to have a say on how do they want the HIV and AIDS issues to be dealt with going forward, with a view and contribution from young people. We will have a delegation of young people that is part of the entire South Africa delegation that is going to be going in there. So it's about report back, but also getting a mandate as to what should be our priorities when we the next coming 2 years. And I think it's important to be able to also to say the UN has agreed on the 1990 strategy. 90% people gets tested. Those who are tested, 90% of them must know must be on ARVs. Those on ARVs must have their viral load suppressed. So it's to also give those reporting to say where we've not achieved those UN AIDS target, what is that we need to do to move forward. Because just imagine if out of all of us sitting in this room were to know our status, South Africa will be a better place. Because I know what I'm getting myself involved with when I have sex with you, and you also in turn know very well, because we are both taking responsibility.
Interestingly, I've heard a lot of varsity kids complaining about, or at least talking about the fact that if you can provide, you need to be able to provide condoms more openly. And we are seeing them everywhere. So is it a case of providing those condoms, male and female, everywhere, and making sure that accessibility is also there? But also then saying, we understand that you're having sex. It's okay. I think we now need to stop saying, yeah, sex is bad. We need to stop. It needs to just end.
Because kids know they're lying too.
It's yum yum.
Sex is nice.
It's yum yum.
They know we're lying if we say that, And I think parents
In fact,
get
they don't care.
embarrassed.
They don't even, it's not about them knowing that we're lying. They don't care.
They're just not bothered.
They're just gonna do it. It's like psychology. When you tell a child, "Don't touch this plate. It's hot. You're gonna burn."
That's
They're
what they do.
That's
They need to
exactly
touch and
what
then
the-
feel the
exactly.
heat, and then you were saying.
And I think the price is too high, and I think that's what we're saying. And I think as Gauteng, it's going to be a great opportunity at the AIDS conference to really, because we're like the New York of Africa, Johannesburg. And we have people from all over Africa, all over the world converging here. And I think it's a great platform for us to say, this is how Joburgers are having sex. This is the context of our sexual lives. And these are now the solutions that we have, taking into account these contexts. Because I think before, long ago, the messaging was too much into don't have sex, abstain. But we know people don't abstain. We know that it's hard. They don't do it. But what we're saying now is, if you're having sex, be safe. This is how you be safe. So we're giving you the tools to be safe, as opposed to saying don't do it.
We've got a minute to go, and we need to wrap the show up. So just before we do that, I think let me give the MEC the opportunity now to wrap up the show for us, and your final message on this one.
Mapaseka, what I'd like to really see going forward, that we must all take responsibility of knowing our status, and be able to also tell the uncomfortable things about what is going on in our society and do something about it. And I think action for me speak louder than words, whether is it allocation of resources towards the HIV programs. And the Premier has been very clear that the provincial government, in addition to the resources we get from national, we must allocate our resources as a province to fight HIV and AIDS. But we need the entire society to come behind this agenda for us to succeed. It's not a government issue. It's not a church issue. It's not about gays and lesbians and all of that. It is about about me and you and each and every one of us.
Good message there. Yeah. It's about everybody. And we all need to stand up and actually collectively do it. Individually and collectively.
Risks. You know, once you understand your risk and the type of sex you're having and why it's risky, then you sort of understand why then you have to take certain precautions.
And also what you stand to lose. So important. Thank you very much for joining us.
It's a pleasure. It's a pleasure. Thank you very much.
Dr. T, Thami Dish.
Thank you.
Thank you very, very much for being here. Have a lovely weekend, Mkaya. We're back again on Monday, so you have yourself a good show. I always say have sex. Yes, have sex. Go out, have lots of it safely.
Dedicate.
That's
please.
it.
We've got flavored condoms now.
Safely.
They're nice.
And dedicated.
And they're free.
And Thami Dish needs a whole lot of dedications. Please dedicate to him as well. Lots of it. Bye.